Let's take you back to some of the reaction around the signing of the National Health Insurance Bill into law by President Cyril Ramaphosa come Wednesday. We bring in former SA Medical Association Chair Dr. Angelique Coetzee joining us to expand on this discussion. A very good evening to you. Thank you for your time. Organizations like BUSA, opposition parties, trade union Solidarity are all against the signing of this bill. They're saying that if the president will be doing so come Wednesday, they're going to take legal action. What is your view around this?
Good evening. Yes, this is actually a very controversial bill that will be signed into law tomorrow. And we know it was going to be signed. We always knew it is because it's a political thing before the elections. And I don't think Mr. Ramaphosa has got a choice. Whether he agrees or not, it's not relevant. It's what his party wants. So if we look at this, and this is what Treasury also said. Treasury said that the government's plans for national insurance most likely will take many years to be implemented. And this is one of the problems, as there is limited scope to fund it with higher taxes. And then also Section 33 is problematic. But let's come back to the term NHI. NHI only refers to the funds that is needed. I think it's important to understand we already have universal health care in that everyone is currently entitled to a limited range of government-funded care. So, and there's no such a thing that healthcare will be free. There's no free rides, especially as I've said in healthcare. So, and then coming back with NHI, with the signing of the bill is, I think people think that by tomorrow, when this is signed into law, that there is an expectation that magically our public services will be on the same level than the private sector. But let me tell you, the private sector services perceived to be much better. It's only a perception that it's much better than the public sector. It is because the service delivery bar is not very high in the public sector. There are very good public institutions, don't get me wrong, where the healthcare workers are doing their utmost best with limited resources available. Here, the Competitions Commissioner inquiry identified private practice or the private sector problems. It was supposed to be implemented by National Department of Health, and up until now, we showed that we've seen that there is little appetite because of the envisage of the NHI. So let's come back to the funding because we say it's economically not viable. So here's the thing, what the NHI will cover is unclear. It's not defined. It's not knowable. We do not know. There's no published attempt at a comprehensive costing for National Department of Health as required by law. National Department of Health also indicated that they will put regulations in place as they proceed, which make no sense. And no other country appears to have imposed a regulatory limit on the scope of private healthcare coverage where, for example, your private healthcare providers are prevented from covering hip replacements or kidney or dialysis, treatment of diabetes or hypertension, etc. And this is what's going to become a part of Section 33. We also saw that Sandile Buthelezi, the DG, said that NHI would be phased over time, and according to him, that the first 3 to 5 years will be just dealing with the fund. Because the NHI currently is only a fund. We do not know what it's going to cover. I also need to make you aware that we've briefly touched on Section 23. The Nicholas Crisp, Dr. Crisp said that NHI will purchase what the economy is able to pay for. And yes, we have heard that there's a large proportion of money of the annual GDP on healthcare, 277 billion in the private sector, 265 billion in the public sector, but the outcomes still stay poor. Now I want to come back to also because people are saying that the rich is or the privileged doesn't want to belong to, doesn't want to see the medical schemes going. But people belong to the medical schemes is around 9 million. The stats shows that about 50.2% of the beneficiaries are black, 32.3% are white, 9.8% Indian, and 7.6% are colored. Yes, it's true that about 85% of people make use of the public sector, and a significant number of them still pay out of pocket for private healthcare. We know there's various reasons for this. And if that is not been addressed,
Dr. Coetzee, expand on some of those various reasons. I mean, you said that the service delivery bar is not very high, and of course that speaks to the ratios, doctor versus patient or nurse and patient, and the number of vacancies that still need to be filled, doctors who have graduated, ready for work, but unable to be placed in any hospital because, for one, budgetary constraints. How is that going to work?
So yeah, well, we also would like to see. So if you look at the 2030 Human Resources for Health Strategies SA, it has not been properly introduced and are currently lacking a comprehensive policy on human resources. As you correctly said, currently, the current evidence is that less than 20% of our medical workforce is serving approximately 75 to 80% of the population. And yes, the public healthcare budget increased by only 1.7% from 2023 to 2024, and by about 267 billion. And this year, the 2024-2025, by 271.9 billion. Which is a 2.9% real cut on once adjusted for inflation. And that's a problem. So we're cutting the healthcare budget. We then said that we need to have around about the older estimations were that around about 200 billion would have to be sourced from taxes. And the newest data is that it's higher, it's much closer to 800,000 billion a year. And then if you want a comprehensive coverage, we're looking at 1 trillion. Now here's the problem, what we are sitting with. As Discovery, Alan Gore from Discovery estimated that the NHI Bill will cost around about 859 billion for prescribed minimum benefits. If we just look at the 2023 budget healthcare of 233 billion. So there's a shortfall of over 600. Now let's come back and look at what is only to raise 200 billion in the current fiscally constrained environment. We need to look at and this was a study done by FTI, the VAT should increase from 15 to 21%, or your personal income tax increases by 31%, or a payroll tax on those employed in the formal non-agricultural sector of an estimated 1,565 rand per month. Yeah. This is only to raise it by 200 billion. So I don't know where the money is going to come from.
Very well. Thank you so much for weighing in on this very important discussion. Former SA Medical Association Chair, Dr. Angelique Coetzee.